To health news now. The province is reporting its first measles death in at least 35 years. Public Health Ontario says a child younger than 5 years old died after contracting the virus. The child died in Hamilton. The agency says the child was one of 5 who had not been vaccinated and required hospitalization. No measles deaths have been reported in Ontario since tracking began back in 1989. 22 measles cases have been confirmed in the province since the start of the year. The last time cases were that high was back in 2014, and that number was for that entire year. Now, for more now on the rising number of measles cases in this province, we're joined live by Dr. Kalina, Assistant Clinical Professor at McMaster University and Chief Medical Information Officer for Brant Community Healthcare System. Doctor, thanks for being with us today. Hello.
Thanks for having me, Melissa.
Now, we've been talking about these numbers for a few days now. It was a late week update that came from Public Health Ontario. Tragically, 1 death involving a young child. 22 cases have been confirmed so far. We are a province of about 15 million people. I wonder what these numbers are telling you.
So when we look at the numbers that Public Health Ontario released on Thursday, you're right. At 22, we're already at the same level that we saw with our most recent peak, which is in 2014. And we've still got majority of the year to go. So the numbers are way higher than they need to be. And it really is reflective of not only vaccine rates here in Ontario, but also vaccine rates around the world. Of course, with the news that poor child died in that last time period as well was also tragic news, and it really highlights the fact that vaccination is so important, not only for prevention of severe illness and indeed most measles illness at all, but that highlighting all of the children that were hospitalized over this year so far have all been unvaccinated. So really a lot of important information from that data from Public Health Ontario.
I wonder if you think there's a misconception about the severity of measles.
Yeah, I think people often think of measles as a very, very infectious disease that really doesn't cause any severe consequences. It does, though, and of course we're seeing the most severe consequence now with this death, but it causes a number of other severe consequences as well. Neurologic, respiratory disease, there's a lot of severe consequences of this disease, and it's important to recognize because of the fact that it spreads so effectively, that's why vaccination is so important. Not only for children, but for adults to ensure that they're vaccinated as well.
Oh, now, most of the cases we're seeing in Ontario right now are linked to travel. We're getting into the busy summer travel season. How much of a concern is that for you?
I mean, it is a concern. It's important to recognize, as you've said, the majority of the cases are imported into Ontario. But that really does highlight that if you're traveling, you need to make sure that you are fully vaccinated. And that means that you've had 2 doses of measles-containing vaccine. Now, those are usually given between the ages of 1 and 4. But if you have a child that is between the ages of 6 months and a year, you can actually start that vaccine series a little bit earlier as well to gain that extra protection, especially if you're traveling to an area of the world where measles has never been eradicated. And so that's a simple blood test or a simple call to your family care team, your family physician, etc. It's really important to take that ownership and that responsibility to ensure that you're protected.
Now, measles was considered eliminated in Canada decades ago. Here we are in 2024, a rising number of cases here. Did you ever think we'd be at this point?
In a word, no. When I was training, when I was in residency and fellowship, measles was the disease that you learned about kind of through textbooks. We didn't see a lot of measles. I remember my first case of measles that I was involved with many years ago, but those cases were kind of single digits, and now we're seeing many, many more, and that's an important thing to stem. It's an important thing to reverse that trend. And while I do think some of it is related to the pandemic, and because people had other focuses, public health had other focuses, and because it's underfunded, people don't have the vaccines that they need to have. But it's so important, as I've said, to take that responsibility for your own health and for the health of your children to make sure that they are vaccinated, not just so that they can do things like go to school, but also so that they can protect themselves and the people that surround them and prevent severe consequences like this death.
I'm also wondering, too, now that we're kind of relearning about the risk that measles poses, who's most at risk? Who's most vulnerable?
Those who are unvaccinated, point blank. The fact of the matter is the vaccines against measles are exceptionally protective. I think in excess of 97, 98% effectiveness with 2 doses of the vaccine. And so if you have somebody who has measles in a room, for example, full of unvaccinated people, that one person will infect 10 to 15 new people, as opposed to, say, COVID, that it would have been 3 to 4. Of those people, none of them would have been essentially infected if they were vaccinated. And it just goes to show how powerful that vaccine is and how important it is for your immune system. And so by and large, those are the people that are most at risk for getting measles.
Important information there. Thanks so much for being with us, Dr. Dale Kalina. Lovely chatting with you today.
Thanks again for having me.